when I saw my grandmother coming back from having a facial rejuvenation. Right then, I knew that I wanted to become a plastic surgeon. I actually graduated summa cum laude out of my medical school. Then I pursued my career in plastic surgery, and I actually was trained in Houston. I met my wife in Houston. We got married, and after a year, little Hector was born. When he was 8 months old, we actually moved back to San Diego for me to establish my practice here. We love to travel. We love to spend time together as a family. One of my passions is actually wine appreciation. I'm a Chevalier du Tastavan. It's one of the most important wine fraternities, and it's all about celebrating the traditions of Burgundy. One of the things that we love to do every evening is actually finish our day in the wine cellar. Hector reading his book and me reading about plastic surgery, or sometimes even reading about wine. Little Hector and I are passionate drivers of Aston Martin. To give you an idea of the strength of the background that I have in breast augmentation, in Houston, I trained in the program where the silicone breast implant was invented. I also have an intense solid background in breast reconstruction. So if we can reconstruct a breast starting from scratch, definitely we can improve the look of a breast. When the patient schedules an appointment at La Jolla Cosmetic, the 35 years of experience that we have as a group immediately starts permeating in that patient experience. All of our staff is very approachable. Everything is centered on the patient experience. The patient has a very clear image of how they want to look, but it's really important for me to be able to form or to absorb that mental image that they have. So in order for me to deliver exactly the result that they're looking for. So important things are to dedicate time to that patient, to listen to all the different goals of that patient, to have no surprises after a surgery. And that's something that patients tend to fear with breast augmentation, that they don't get exactly the result that they wanted. Simulation is important. So we have, I would say in those terms, two big instruments. One is Vectra simulator, so that's advanced imaging technology that we have in which patients can actually see the result. We take a picture and then we can simulate exactly how things are gonna look. And the second one is also using some dummy implants, sizers that I actually shaped in order for them to be able to appreciate that. How is it gonna look underneath a bra or while they're wearing a t-shirt? So a successful breast augmentation is defined by a happy patient.